In the animated series Common Side Effects, the first and most visible layer of the story is the struggle between Marshal Kuso and the sharks of the pharmaceutical business. But this is not the only layer, and in upcoming episodes we will explore several dimensions of this new saga about a selfless attempt to defeat the conspiracy of Big Pharma. Hit the like button, subscribe to the channel, and ring the bell right now, unless, of course, you're one of them. And so we begin. Just one twisted pigeon neck and a single mushroom turn an ordinary guy in a Panama hat and flip-flops into the most destabilizing force in human history.
If this mushroom gets out, it would be the single greatest destabilizing force the world has ever seen. We've already begun clearing the valley, but if it's escaped...
I'll call the DEA right now. 24/7 stakeouts, whatever it takes.
Cecily, I've decided to supplement your efforts.
But first, let's introduce the opponents. In the left corner of our imaginary ring stands the collective image of the American pharmaceutical company. For our viewers outside the United States, a few figures. Healthcare expenses in the United States make up 15% of GDP. 5 out of the 10 largest pharmaceutical companies in the world operate in the United States, controlling about 40% of the global medicine market. The problem, in my view, is that these companies make money, not health for citizens. The guiding principle is one problem at a time. If they cured your diarrhea, then it's time to start treating your depression. Beat the depression? Great, now let's deal with enuresis. Side effects and super profits are synonyms. However, if we start drawing comparisons, other wealthy countries spend on average around 10% of GDP on healthcare, and their outcomes are significantly better. How did this happen? If doctors swore the Hippocratic Oath, then everyone else working in or around medicine deals not with the health of people, but with the health of the industry. What matters isn't how the drug works, or whether it's better or worse than placebo, but that the tests are passed, the conferences are held, and the trips are funded. Healthcare system means the system first, healthcare second. Don't believe the word order. Patients in the United States have the worst access to care among developed countries. American patients face the most interference from insurance companies in their treatment, and there is extreme inequality in the quality of services depending on income. Most importantly, Americans are more likely than any other citizens of developed countries to die from preventable or curable diseases. Even though the United States ranks first in the quality and diversity of available medical services, that only applies in cases where those services are actually provided, and when patients manage not to go bankrupt. All this leads to wonderful consequences like medical debt. 1 in 10 Americans carry substantial medical debt, outrageously high prices for the most basic medicines. Insulin costs in the United States are on average 10 times higher than anywhere else, and ambulance rides that can bankrupt you on their own.
I spoke with the person, I think it was Diane,
Okay,
who runs...
Francis, that's the facility. But this is an insurance issue, and if they're not going to cover it, we need to know.
God, okay. Look, I will get the money somehow, okay?
In the right corner of the ring, Marshal Kuso. A good-natured man, a fan of his cause, a humanist, and a bit of an exhibitionist. Behind the pink open shirt and cargo shorts hides a man convinced that we can do better. An intellectual, Marshall made his money by cracking the lottery algorithm. But unlike you and me, he didn't spend it on women and booze. Instead, he traveled to Peru, where on a high plateau he discovered the holy grail of mycology, a mushroom capable of instantly curing any disease or injury, from a bullet-pierced heart to dementia and multiple fractures. In this unequal fight, in this David and Goliath confrontation, our sympathies lie with the underdog, and understandably so. While Pharma makes billions off our suffering, the lines in hospitals grow longer. Yes, we live longer now, but only to endure increasingly convoluted illnesses that threaten to turn our last years on Earth into hell. But is there a way out of this vicious circle, even with the holy grail of a sky blue mushroom? Marshal tries to find one. With the help of loyal Socrates and the slightly less loyal Francine, he finds a way to reproduce the mushroom, but cannot figure out a path to get Peru's gift into the mouths of all who suffer.
Mushroom first, right? That's important. Oldest people, the sickest, and what if someone's super sick, but they're also super racist? Does that guy still get it?
Marshal.
I know.
Take a breath. Okay?
Following Hegelian logic, the mushroom passes through the hands of a classic capitalist pharma company thanks to Francine. This is thesis, but through research and testing, the panacea degenerates into nothing more than a unique spice. After all, capitalists don't care about the common good, only profit. And producing a spice is far easier than making medicine. Then the mushroom falls into the hands of militant rural radicals. This is antithesis, who distribute it to the sick but also use it as a drug. Collecting more and more money from victims, the greedy rednecks with rifles and landmines become a pharma company themselves, only more reckless in their greed. Greed that nearly kills Marshal, an achievement none of the earlier corporate assassins could boast of. Only by rejecting their selfish impulses, with the mushroom's help, do our heroes arrive at the threshold of a third path. This is synthesis. But does it exist? Is there truly a way to save everyone and achieve happiness for all, free of charge, with no one left unsatisfied, health or high? That's worth more than money, and has nothing to do with companies or breakthrough technologies. The ancient man fears death, and will trade all his wealth for even the illusion of a brief delay. The young dealer doesn't sell drugs, he trades them for the illusion of meaning in life's journey to its final stop, death. In that grand scheme, it hardly matters how many companies collapse or how many people or rabbits die in the testing of a new drug. What matters is the number of likes under this video. Otherwise, I literally turned into a skeleton, put on a suit, and explained something that actually does matter. Don't forget to vote for the topic of the next episode. Stay healthy, and if you do get sick, at least make sure you get to the hospital by public transport.